Hello, everyone. My name is Kiley McLean. My pronouns are she, her, hers. I am a postdoctoral research fellow at the A.J. Drexel Autism Institute. Today, I am presenting on one of my dissertation studies, which I defended in May at University of Wisconsin-Madison. This is a systems-level model for improving healthcare for and with autistic adults. I'd like to thank my co-collaborators listed here, and of course, the autistic research participants across the country who took the time and space to share their stories with me over the past few years. As we know, autistic adults account for a significant and rising proportion of the population. At the same time, emerging research has pointed to a host of adverse mental and physical health outcomes experienced by autistic adults. Unfortunately, service systems in the United States for autistic adults abruptly fall off at the point of high school exit. This service cliff has the potential to negatively impact autistic adults into late adulthood, though research in this area remains limited. Therefore, understanding the mechanisms underlying this prevalence of poor health outcomes in autistic adults requires an exploration into the lived experiences of autistic adults across their lifespans. In conversation with autistic adults about the challenges they experience in managing their health and interacting with healthcare systems, this study investigated barriers and facilitators to receipt of quality care for autistic adults. These barriers and facilitators are then conceptualized through the Systems Engineering Initiative for Patient Safety, SEEPS, model developed by Karanon and colleagues. This model illustrates how specific work system structures interact with one another to inform healthcare processes and outcomes. With this in mind, we conducted a series of one-on-one interviews with autistic adults in the U.S. Our 23 autistic adults were eligible to participate because they were 18 and older, had an administrative, professional, or suspected diagnosis of autism, and were able to communicate with us in English. We used semi-structured interviews and probed for experiences with health and healthcare access across 4 domains. We transcribed our data and analyzed it using conventional content analysis, and themes were identified in the text that aligned with the SEEPS model prior described. All research questions and protocols were written, built, piloted, and continuously edited in partnership with autistic adults. Including those with suspected rather than just formal diagnoses allowed us to recruit a more diverse sample and ensure the voices of those whose socioeconomic status prevented them from diagnosis receipt were included. We also used unique and ongoing recruitment strategies through avenues like Twitter and Reddit, as well as placing physical signs in restaurants, community centers, and gaming stores that autistic adults in our community recommended. Here I present our adapted systems model for improving healthcare for autistic adults. Through this model, we describe the interactions between autistic adults and their healthcare systems to identify points for improvement and intervention. Within the organization component, for instance, barriers and facilitators that impacted autistic adults' receipt of care included whether they had informal and formal support to go with them to doctor's appointments, the length and strength of their relationships with their healthcare providers, as well as doctors' understanding and prior experience working with autistic adults. Many autistic adults noted that lights, noises, and smells in healthcare spaces impacted whether they would visit a doctor when something is bothering them. Our model suggests that to improve healthcare outcomes for autistic adults, interventions must target both personal factors such as challenges with executive functioning or sensories, as well as organizational factors, such as healthcare professionals training in autism. We present this adapted SEEPS model, emphasizing the need for the entire healthcare work system, rather than just one structure within it, to be well designed for optimal performance. This proposed model is intended to serve as a launching point for future research, practice, and intervention. I am currently proposing a project to hold focus groups to present this model to healthcare providers so that we can develop practical applications of the findings. For instance, what ways can providers and practices feasibly make their environments and organizations more accessible to autistic adults? I'm currently seeking input from all stakeholders on what you think should be prioritized, as well as what feels feasible to healthcare professionals. I would love to hear from you on your thoughts and feedback. Here is my email, and I will see you at AUCD. Thank you.